So my name is Dave Stammers. I'm one of the pediatric hematologists in the province of Saskatchewan. And so my project is about sickle cell anemia, and this doesn't project super well, but those are sickle cells. There you go. And so sickle cell anemia, again, is a relatively small patient population in our province, but it's growing substantially. And so I think I joked on the very first meeting that we've grown by 100%, over 100%, since I've been in the province. And actually, this slide says that there's 37 pediatric patients with sickle cell anemia. I think we're now, since making these slides, we're above 40. And if you look at other prairie provinces, Edmonton, for example, is a little bit ahead of us, but about 10 years ago, they only had, the hematologists there knew the patients by, like, on a first-name basis, and now they have over 100 patients. So we're well on our way. So this is a growing population. One of their major issues is that they present to the emergency department with pain crises, so pain in their, often bony pain, but just those sickle cells get trapped, and you can't deliver oxygen to your muscles and your bones, and is the major cause of hospitalization and morbidity in these patients. So there are national guidelines in Canada as well as the United States that basically says that when these kids, or adults, because they will turn into adults, present to the emergency department with a pain crisis, the goal should be to get a dose of opioid analgesia into their system within 30 minutes of triage. That is a great goal. I don't know if that's achievable everywhere. And so this is the baseline data. My subscription to QI macros expired, so that's why I was looking a little janky, but whatever. I think you guys get the point. So this is all pre-intervention. You can see that our patient population takes on average about over an hour and 15 to get the medications into them. The other secondary findings, and I'll talk more about this at the poster, is that some of our patients are being underdosed and some of our patients are not being scored appropriately based on triage scoring systems. So one of the challenges that I had was there is good evidence in terms of what interventions work to improve this quality measure. So do you start fresh, bring in the whole team, and try to kind of say, hey, what do you think is going to work, when you know that there's actual published data saying, like, having a pre-printed order set works? And so that was kind of one of my struggles. And so where I landed is kind of we're going to adapt to something that already exists instead of starting something that is totally fresh. So we're going to Saskatchewanize it. Major learning points. Again, is how do you, as I said, how do you balance kind of stakeholders' input when you already know what works? Choosing when you have a small patient size and small sample size, how do you measure those outcome data? So we've actually, since the pre-data, there's only been one visit to the hospital for pain since then, so a little hard to measure. And as people have mentioned, kind of how do you incorporate QI when you work in a system when there's two pediatric hematologists, both of us who are in this room right now. And that's it.